Natural and home remedies for gallbladder disease. The gallbladder is a little pear-shaped pouch tucked behind the lobes of the liver. Its main job is to store up the cholesterol-rich bile that's secreted by the liver. Bile helps your body digest fatty foods. So when that piece of prime rib reaches the intestines, they send a message up to the gallbladder to send some bile their way. Once the bile saturates your steak, it becomes more digestible and easily makes its way through the rest of the digestive process. At least that's the way things should work. But the reality is that many people, especially older people and women, will have some gallbladder trouble. 90% of the time that trouble is in the form of gallstones. Gallstones form when the bile contains excessive amounts of cholesterol. When there isn't enough bile to saturate the cholesterol begins to crystallize, and you get a gallstone. These tough bits can be as tiny as a grain of sand or as large as a golf ball. You may not even know you have gallstones unless you happen to have an ultrasound or X-ray of your tummy. But the 20% of the time that gallstones do cause problems, it's excruciatingly painful. Gallstones become a problem when they get pushed out of the gallbladder and into the tube that connects the liver and the small intestine. The tube gets blocked, and you get 20 minutes to 4 hours of indescribable agony. Pain usually radiates from your upper right abdominal area to your lower right chest, and it can even leave your shoulder and back in agony. Gallstones typically fall back into the gallbladder or make their way through the duct, leaving you feeling better. After you have an attack, you'll probably be sore and wonder what in the world happened. Sometimes, though, the gallstones can get stuck in the bile duct. Symptoms of a stuck gallstone include chills, vomiting, and possibly jaundice in addition to the pain described above. Pregnancy, obesity, diabetes, liver disease, a sedentary lifestyle, a high-fat diet, and certain forms of anemia can all increase the risk of gallstones. People who are overweight and lose and gain weight repeatedly are more susceptible to gallstones, as are women who have had 2 or more children. Lack of exercise is a significant contributor to the development of gallstones. In fact, according to the Nurses' Health Study, inactivity can actually account for more than half of the risk of developing gallstones. Women are twice as likely as men to develop gallstones, although the reasons are unclear. And people older than 60 years of age have a greater risk of gallstones. Other risk factors include a family history of gallstones and taking hormones, such as birth control pills or estrogen. Take heart. There are some specific things you can find in your kitchen to help you avoid a gallstone attack and even prevent gallstones from forming in the first place. What you eat has a great effect on whether or not you develop gallstones. Go to the next page to learn about natural home remedies that reduce your risk of gallbladder problems. Use a heat pack or heating pad. For immediate relief, apply a hot water bottle, heating pad, or other heat pack to your stomach, directly over the gallbladder. The heat should help soothe the pain. It is recommended that you apply the heating pad in 20 to 30-minute intervals and keep a layer of cloth in between the heating pad and your skin to prevent burns. If you do not have a heating pad or hot pack, you could also try soaking in a hot bath. Sip on a little vegetable juice. One unproven home cure is to mix beet juice, carrot juice, and cucumber juice in equal proportions. Drink this mixture twice daily for 2 weeks. All 3 vegetables help flush toxins out of your system. Whether this is true or not, some swear by this remedy and insist that it can help ease gallbladder pain slightly upon digestion and gradually clear the pain after a few weeks. Turn to citrus. The pectin in citrus fruit and juice is believed to help get rid of gallbladder pain attributed to blockages or stones. Lemon juice is especially effective. Squeeze the juice from 4 lemons and drink it on an empty stomach. Note that this should be anywhere from 8 to 12 tablespoons, 120 to 180 milliliters, of juice. Do this on a daily basis for about a week, and follow the drink with a glass of water. Blend turmeric and honey. The curcumin in turmeric should help make the bile in your gallbladder more soluble, while the honey has antiseptic properties that can help prevent infection from setting in and making things worse. If you decide to use turmeric, mix 1 tablespoon, 15 milliliters, of honey with 1 teaspoon, 5 milliliters, of turmeric and consume the combination once a day. To skip the turmeric yet still get the benefits of curcumin, take a 300 mg curcumin supplement, instead. Take a dose of apple cider vinegar. The acidic properties of apple cider vinegar provide quick relief for gallbladder pain and may even significantly ease the pain within 15 minutes. If you have a hard time with the taste of apple cider vinegar, mix 1 teaspoon, 5 milliliters, into 1/8 ounces, 250 milliliters, glass of apple juice and drink that. If you have a higher tolerance for the taste, though, you could try drinking 1/4 cup, 60 milliliters, apple cider vinegar followed by 8 ounces, 250 milliliters, of apple juice for more immediate relief. Drink salt water. Mix coarse salt into a glass of warm water and drink the water before going to sleep to help loosen painful buildup in your gallbladder. For best results, use Epsom or sea salt. Do not use table salt. Mix 1 teaspoon, 5 milliliters, of salt into 8 ounces, 250 milliliters, warm water until dissolved. Drink. Try a castor oil compress. Placing a rag soaked in pure castor oil on your stomach, directly over your gallbladder, is said to help reduce pain associated with the gallbladder quickly and dramatically. Castor oil is supposed to help neutralize inflammation and bring relief when applied topically. Soak a clean rag in cold-pressed castor oil, wringing out the excess before use. Place that rag on your bare skin over the pained gallbladder. For even more effective results, place plastic over the rag, followed by a hot water bottle. Keep this castor oil compress on for 30 minutes to maximize relief. Drink plenty of water. Water can help keep bile in your gallbladder and make it easier for your body to break down fat that could otherwise build up and cause or worsen gallstones. Get the maximum amount of benefit by drinking 6 to 8 8-ounce, 250 milliliter, glasses of water daily. Reduce your fat and sugar intake. Both fat and sugar can cause gallstones or further agitate pre-existing stones that already cause pain. Note that omega-3 fatty acids, like those found in salmon and other types of fish, might actually help your body defend your gallbladder against stones. In particular, you should cut unnatural fats like hydrogenated oils, soy, and canola from your diet. When you need to use a fat in your food, stick with something more natural, like butter. Your fat intake should only make up 25% of your daily calories. Dietary cholesterol should take up no more than 300 milligrams each day.